The early childhood brain development story has been a powerful influence on the growth of investments in programs to promote early learning and enhance school readiness. But the brain does not exist by itself. Connecting the brain to the rest of the body is critically important. Early childhood experiences are much as lifelong physical and mental as they are about early learning and readiness to succeed in school. All biological systems, all of them are highly interconnected, and all of these systems are primed to adapt to whatever the environment would throw at us. Think about this as a team of highly skilled athletes. Each has a role to play, but they are dependent on each other. They influence each other's response. Like any good team, it's how they operate together that is the key to their success. When we are stressed, every cell in our body is working overtime. The brain is the master control system that detects early threat. They manage the response in all of the different systems. It sends signal to the cardiovascular system to increase the heart rate and blood pressure. Signals are picked up by the metabolic systems to increase the availability of blood sugar to provide more energy stores for the body. The immune system is activated to be on alert for the possibilities of a wound with the need to protect against infections. The neuroendocrine system is activated to increase the level of stress hormones in the bloodstream. All of these also provide feedback to the brain. The stress response system was designed to deal with an accurate threat or challenge, but when the stress content is at a very high level, then these biological responses actually start to have a wear and tear effect on the body. This is where stress explains chronic disease. The science is clearly the most costly chronic disease in our society have their roots in early childhood vascular disease, diabetes and depression, three of the many diseases that are associated with great adversity early in life. These three diseases together consume more than 600 billion of healthcare cost a year. So we want to think about preventing disease and promoting health. It doesn't begin with exercising more or eating better when you are in your 30s and 40s. Health promotion and preventing disease begins prenatally and it extends into the early childhood period. Connecting the brain to the rest of the body has very important implications for early childhood policy. If we look at the basic science-based principles, focused early learning, strengthening relationship, building skills, reducing the source of stress, those are the same principles that increase the likelihood of lifelong physical and mental health. And when we think about the major sources of adversity early in life, we talk about poverty, discrimination, exposure to violence, maltreatment, child abuse, neglect. Through each of these sources of adversity is differing. Biologically, the effect on the body is the same. Systematic racism, the danger of implicit bias, everyday discrimination, imposing a level of stress and adversity on families of color, raising children that present all the time. It's never too late to make things better, and we are biologically prepared to adapt to whatever environment we live in. But when we need to look upstream at more systematic issues that are the sources of this economic burden of threat and hardship, we have to connect policies and resource allocation from the educational sector and the health sector and the human service sector. Pediatric primary care is one domain where almost all children are seen from birth and provide a critical opportunity for engagement with families, developing relationship, promoting healthy development, and is the ideal frontline opportunity to connect families to needed services as early as possible when they can be most effective. Pediatrics alone is not going to provide all the support that many families need. The opportunity is to move away from asking how we can connect pediatric primary care to early childhood programs in a different way, changing our mindset to say how we build a early new year ecosystem in which pediatrics is an integrated part of the brain development story has been a powerful influence. The same principle, the same concept are also affecting the early foundation of physical and mental health that will last for a lifetime.